Very good evening to everyone, and a very warm welcome from Mom's Belief to you all in today's session. We are honored today to have Dr. Yatheesha with us, who will be talking about neurodevelopmental disorders and their management. Allow me to introduce to you all Dr. Yatheesha, who's a pediatric neurologist from Shimoga. Dr. Yatheesha completed his MBBS from MS Ramaiah Medical College, Bangalore in the year 2003. He did his diploma in child health in the year 2006 and subsequently completed his diploma in National Board at Amrita Institute of Medical Science and Research in the year 2009. He's undergone a postgraduate certificate course in adolescence health from IMA AKN Institute of Continuing Medical and Health Education and Research. He also has a certificate course in law and medicine, as well as a PG diploma in developmental neurology from the University of Trivandrum. He attained his fellowship in pediatric neurology from Amrita Institute of Medical Science and Research Center, Kochi, in the year 2017. Dr. Yatheesha started his professional journey as a resident medical officer at various hospitals in Bangalore. He has worked as a pediatrician in various hospitals like Samaritan Hospital in Ooty. He's worked as a senior resident in the Department of Pediatrics in Amrita Institute of Medical Science and Research Center, and also has worked as a registrar in PVS Memorial Hospital, Kochi. Not just this, he's worked as a consultant pediatrician in TSS Hospital, Sirsi, and Vatsalya Hospital, Shimoga for now more than 5 years. Dr. Yatheesha was solely responsible for handling all the pediatric emergency, including the mechanical ventilation in Vatsalya Hospital, and that contributed a lot in his extensive pediatric neurological knowledge. To top it all, he has a long list of rewards and recognition. To name a few, he has been conferred with Dr. B.R. Santana Krishnan Gold Medal. He has been awarded as the best doctor at Vatsalya Hospital, Shimoga. He has served as a secretary in the IAP chapter of Shimoga in the year 2013 and 14. And he has delivered lectures at various CMEs in Shimoga and across Karnataka. A very warm welcome to you, sir, and honored to have you today. Over to you, Dr. Yatheesha.
Thank you, Dr. Nalini, for a nice introduction. And I also thank Mom's Belief for organizing a interactive session. I think it will be helpful for the parents, because in the COVID situation, it is very difficult for them to know to clarify their doubts, and they will have a lot of doubts regarding their child behavioral or management. So today I will be talking about the neurodevelopmental disorders. Before we start discussing about the neurodevelopmental disorders, first let me clarify the difference between the growth and development. The growth is the quantitative phenomena where the child will be increasing in the size, that is, he will be gaining the weight or height. So this is the growth. Growth is the increase in the height or weight or increase in the head circumference. Whereas the development is the qualitative phenomena. It is the maturation of the function where the child will develop the skills and the capacity to function independently. The child development start from the conception and it will continue till the adolescent and even into the late adulthood. Please remember that the child development start in vitro, that is, the child has born before only, and the majority of the child development will be happening the first initial 2 to 3 years of the age group. That is very critical period that I will explain in later why it is very, very important. The major domains of the development are grossly divided into gross motor, fine motor, adaptive, personal and social development, language development, hearing and vision development. The gross motor development is necessary for the child locomotion. Fine motor development are necessary for our day-to-day activities like mixing the food, reading and writing. Personal social development are required for interpersonal and social skills. Language development are required for the communication. Communication may be verbal and or non-verbal communications. And the hearing, normal hearing and vision is very, very important for the child development. In this slide, you can see how the child gross motor develops from the newborn till the 1 year of the age group. In the at 1 month of age, child will be in the fetal position and start walking independently at 1 year of age group. In this slide, you can see how the child starts reaching for the object, transferring the object, hand-mouth coordination, hand-eye coordination, ultimately resulting in self-feeding, self-playing, dressing and dressing, and the skills necessary for the reading and writing. And the social development also occurring simultaneously. It will start around 2 months of age group in the form of social smile, stranger anxiety at 6 months, and responding to name by 1 year of age group, and identifying the family members between 15 to 18 months of age group. The communication means sharing or receiving of information, ideas, feelings, or messages between two or more people. It may be verbal or non-verbal, as I already mentioned. These include speech, writing, facial expression, and gestures. The speech milestone starts by 3 months of age in the form of cooing, monosyllables at 4 to 6 months of age group, and true word at 1 year, 10 to 15 vocabulary at 18 months of age group, 2-word sentences at 2 years, and 3-word sentences at 3 years. Even though you have assessed or defined the child development in different domains, they are occurring concurrently. The child development in one domain will be influenced by the development in the other domain. Finally, the wholly dependent and reactive infant will become a proactive and relatively independent child at the school entry. Please remember, the child development is a dynamic process which is a complex interplay between the genetic and the environmental factors. We need to know the developmental milestones because we have to know whether the child is developing normally or not. If the child is not developing normally, in which area he is delayed, to know the exact reason or type of his developmental delay, to identify the cause for referral to appropriate rehabilitation services and management of the associated comorbidities. So we can assess the child development using the various screening chart. These are easily available in the online. They are varying from a simple screening chart to the detailed developmental assessment by using the Neurodevelopmental screening chart. So now come to the developmental delay. So developmental delay is one of the most commonest problem we encountered in the pediatric or pediatric neurology practice. The prevalence varies across the different regions from 1 to 3% even to the 6 to 8%. This slide shows the various causes of the developmental delay. I have shown this slide so just to tell you that the developmental delay is just a symptom. It is not a diagnosis. And the developmental delay will be happening because of the so many causes, the varying from hereditary factor to the acquired factor and environmental factor. Sometimes even after the extensive investigations, you will not be able to know the causes in about the 30% of the cases. All developmental delays are now broadly grouped under one entity called neurodevelopmental disorders. These include global developmental delay, intellectual disability, cerebral palsy, visual impairment, hearing impairment, attention deficit and hyperactive disorder, autism spectrum disorder, communication disorder, and learning disorders. Now we will go one by one. The global developmental delay means if the child is delayed in more than 2 domains of the development, we will call it as a global developmental delay. For example, if the child is delayed in gross motor and cognition, or cognition and language, or language and personal, it is called a global. Global need not to be in all domains. If the child has delayed in more than 2 domains of the development, we will call them as a global developmental delay. The global developmental delay is a very non-specific entity. because in younger age group, especially in less than 5 years, it is very difficult to characterize the exact phenotype. Sometimes the learning disability can mimic as a global developmental delay, and autism also or ADHD also, they will have coexisting global developmental delays. So in children less than 5 years of age group, we use the term global developmental delay. As the child grows and his clinical phenotype becomes better, and once you are able to assess his IQ, you will categorize this global developmental delays into the various neurodevelopmental disorders I have explained previously. Now the term used for global developmental delay is the intellectual disability rather than mental retardation after the 4 years of the age group. In children with intellectual disability, they will have deficit in the language, attention, memory, reasoning, judging, and academics. So in total, they will deficit in the understanding or in the cognitive functions in the, with or without the delay in the other domains. This leads to their limited function in the daily life activities and failure to meet the personal independence and social responsibilities. And the kids with the developmental disability, we like to see them, they will learn to talk late in the life. There is slow development of pre-academic skills like scribbling, matching the forms, letters, recognizing the logos, copying the vertical or horizontal strokes, difficulty in understanding social cues and social rules, trouble in regulating, monitoring the emotions and behavior, and they will have very difficulty in telling the time and understand the concept of the money. These are all the various problems we will encounter in the children with the intellectual disabilities or the older term mental retardation. Now we will move on to the motor delay. The motor delay or development or delay in the motor skills may be due to various factors like cerebral palsy, ataxia, spinal problem, or neuromuscular problem. The cerebral palsy is the most commonest cause of the motor delay. It is in a heterogeneous group, which means to say even though the core symptom or main symptom is they will have delay in the motor skills. In addition to their delay in the motor skills, they will also have a disturbance of sensation, perception, cognition, communication, and behavioral changes. They will have seizures and they will have musculoskeletal problem. And it is the most commonest cause of the delayed motor skills. The cerebral palsy are divided into the various types. There are various methods of classifying the cerebral palsy. Either they will be spastic. Spastic means they will have very stiff limbs. Dyskinetic. Dyskinetic means they will have abnormal and involuntary movement. Ataxic. Ataxic means they will have difficulty in balancing. The spastic type of CP is again classified into the hemiplegic. Hemiplegic means they will have difficult or in motor movement in one side of the body involving the upper and lower limb. Whereas in diplegic, they will have stiffness in the lower limbs. Quadriplegic, they will have stiffness or paucity of the movements in all the four limbs. Dyskinetic is again divided into a athetoid and dystonic. Again, these are the two different types of the abnormal movements. And this cerebral palsy is caused by the factors which affect the child growth before the birth, during the birth, or after the birth. There are various causes which which causes the cerebral palsy. Thus, all motor delay are not cerebral palsy. So I want to tell you all the parents that if the child is delayed in a motor skills, please don't think that your child is having a cerebral palsy. In addition to the cerebral palsy, there are other neurometabolic causes, neurogenetic causes, and neurodegenerative causes which can also produce the motor delay. We need to differentiate the cerebral palsy from the other causes because some of the causes may be treatable and they will have different prognostications. In our society, it is very common that if the child is having a delayed in development in any domains, they will have a tendency to wait because the neighbor kid has started walking late or their relatives have started talking late. So they will have their own conception about the development. I want all of you to understand that even though your child is delayed in a development, please do not wait till the symptoms or the disease becomes more complicated. As soon as you feel that your child is delayed in development, please consult your pediatricians or developmental pediatricians or a pediatric neurologist or therapist. There are some clinical points which will tell you that this case may not be the cerebral palsy. I'm not going in detail about that. So next we will come to the autism spectrum disorder. So autism spectrum disorder, as many of you know that here the child will have a difficulty in social interaction or social communication and the restrictive and repetitive type of behavior. So autism kids will not, they will not always not they are delayed. They are always they are unique. They are totally interesting and sometimes mysterious. It is a spectrum. They will have varying from severely affected child to a very highly performing kid. The causes of the autism are varies. Still, we don't know exact causes of autism. The most, because of the now the availability of the genetic test, now we are able to identify the various gene mutations. Now about 50 to 70% of the autism kids will have some genetic causes. In addition to that, they will have the problem in the perinatal period or in the postnatal period. Sometimes they will have unknown causes. So it is again, it is the both the genetic and the environmental factors which will make the child having a autistic behavior. Please, I want again tell you the viewers, please, if a child is having autistic behavior, please don't think that there is something wrong in your bringing up the child or your in a rearing practice. Okay. No doubt, if you allow the child for excessive screen, or if you don't if you don't interact with them, they will have some developmental problem, but that will not lead to a autism. So autism is a totally different disease. It is not related to the environmental or related to the child rearing practice, and it is a biological disease. Please remember, the autism is a biological disease. It is not due to any of the parental fault. Because why I am telling this is many of the parents in our practice, they will start inquiring, sir, we didn't take care in the early days. So I want to convey this message very clearly to all the viewers. So the clinic or the symptoms of autism includes from the poor eye contact, no social smile, to no babbling, pointing at 12 months of age, no one word at 16 months of age, no two word at 24 months of age, and some will have a loss of skills, that you especially they will have a language regression. They will not they will initially they'll be talking 2 to 3 words, they will lose that also. Not responding to sound, voice or name, that will they behave as a deaf. Not showing items or sharing interest. So in simple words, if the child is behaving like as if he is in his own world, or if the child is behaving like a deaf and mute, there you have to raise the concern whether the child is having a autism futures or not. In addition to the core symptom of the social communication and a repetitive behavior, the autism kids will have associated other manifestations. They will include intellectual disability, seizures, sleep deficits, mood disorders, anxiety disorders, and hyperactivity. So autism, in addition to the core autism features, it may be associated with the other neurological symptoms. and we can diagnose the autism, yeah, in a regular or in a day-to-day practice around 18 months to 2 years of age group. But if you clearly observe the child, the autistic features will be evident even as early as around the 6 to 9 months of age group. So if you are thinking that your child is not socializing, not babbling, is or is excessively irritable, if there are some other indicator that your child having some autism futures. So in addition to the autism as a cause of the speech delay, there are other causes which produces the isolated speech delay. Please remember, all speech delay are not autistic kids. So hearing impairment, global developmental delay or intellectual disability, cerebral palsy and epileptic syndromes and brain malformations all can lead to the speech delay. So speech delay is not equivalent to the autism spectrum disorders. And the child is having a speech delay, it requires a detailed evaluation. Now we will move on to the ADHD, that is attention deficit hyperactive disorder, which consists of the symptoms of hyperactivity, inattentiveness, and impulsiveness. They will have to call a child as ADHD. Either they should have a 6 symptoms of inattention or 6 symptoms of hyperactivity and impulsiveness, which should last for more than 6 months of age group and in two different settings. Because why I am telling this is that majority of the toddlers, they looks like hyperactive at home, but when you take into the different environment, they will behave normally. So this hyperactivity or impulse symptoms has to be there in the two social settings, and they should onset before the 12 year of age group to call them as a ADHD. So again, the ADHD will be due to the various causes, as I mentioned previously. The management of the ADHD includes the behavioral therapy and pharmacological therapy. Both go in hand in hand. The management of other neurodevelopmental disorders will differ because, but in for ADHD, we have definitive medical management. If you combine the medical management with the behavioral modification, they will have a better outcome. Now we will come to lastly to the learning disability. So learning disability, and to make it simple, if in spite of good cognitive function, or in spite of you think that your child is normal in his motor development, normal is in speech, and normal is in answering other things, but if he is having a scholastic performance out of proportion means if he's studying in the 7th standard and if his scholastic performance are below the 5th grade, in reading, writing, or calculation, we call him as a learning disability. So learning disability, again, it is in a biological diseases. The most common type of learning disability is the dyslexia, that is they will have a difficulty writing. That is the most common cause of the learning disability. So learning disability is a different from the intellectual disability. Intellectual disability kids will have a low IQ, whereas the learning disability child will have, they will have a normal IQ. And those who have seen the movie Tara Zameen Par, they will remember that the difference between this intellectual disability, global development, and learning disability. These kids with learning disability, not only learning disability, with other type of the neurodevelopmental disorders, they will have some interest, or they will better in some other fields. So you have to identify that is area of interest, and you have to encourage them to bring them into the mainstream. So the management of these neurodevelopmental disorders is a multidisciplinary. The multidisciplinary means here the trained specialists in various fields, they will come together and they will work as a team. So It is a team approach, and team approach is very important for the management of the neurodevelopmental disorders. The team consists of pediatricians, pediatric neurologists, clinical psychologists, special educator, speech language pathologist, occupational therapist. And the main backbone of the team are the parents. The parents has to be motivated and dedicated to make this rehabilitative service successful, which is fully supported by the family and community. Again, in our society, it is very common because they will think that it will become normal after a certain period of the time. If parents are agreed to go for the therapy, the grandparents or the in-laws may not be willing. So the supportive family and supportive community is very crucial for successful rehabilitative service of these specially abled kids. The physiotherapist will assess the child, the motor functions, and he will train the child for mobility, for that is why it's locomotion, by using stretching, positioning, strengthening with or without orthosis. There are various types of physical therapies, including the neurodevelopmental therapy. The occupational therapist will train the child with the skills which are necessary for his day-to-day activities. He will, which includes the physical activities such as stringing the beads or doing the puzzles to help the child develop a coordination and body awareness, play activities, developmental activities, and the adaptive strategies. And the trained occupation therapy will also do the sensory integration. The sensory integration is very important, especially the kids with the autism, with the autism futures. Here, the therapist will use the various sensory modalities like the vestibular sensation, that is a position sense, proprioception, balance, touch, smell, sound, and hearing and vision to train the child. And you will, because in this they will autism's kids they will a sensory processing deficit. The therapist will make sure that the sensory process, and they will make sure that they will train in a proper way, so that by taking care of all the available sensory modalities. The speech therapy is required for almost all types of the neurodevelopmental disorders, varying from intellectually disabled kids to the autism kids. So speech therapist will establish the functional and spontaneous communication. They provide a social instruction in various settings. They will fine tune the communication skills as other areas are improving. The trained behavioral therapist will train the child behavior by using various behavioral modification like sensor integration, adaptive behavioral analysis, and a teach technique. There are various technique of behavioral management. So the process of this therapies is such that the parents with kids will visit the therapy center. They will undergo certain session. They will get trained in the therapies, and they will go and do it at home, and gradually they will shift therapy from the therapy center to the home therapy with a periodical visit to the therapy centers. The main area of target in interventions are the communication skills, attention, social skills, and the play and the other skills. And ultimately, what you want is the child to walk independently, child to do independently his daily activities, child to have a socially acceptable behavior, and for him to have a normal or near normal cognitive and academic skills, and to bring them into the mainstream. That is the main motto of the all therapies. So the by using physiotherapy, occupation therapy, speech therapy, behavioral therapy, and other special therapies, we have to bring these kids which are having a neurodevelopmental disorder into the mainstream. Now, the next question is when to start early, when to start the therapies. The therapy has to be started as early as possible. Now, the approach has shifted from the training or rehabilitation to the early stimulation and early intervention. Why it is important is, as I already mentioned in my previous slides, the child development will be maximal in the early years of the age group. So as you can see in this child, the child development in the sensory or the vision and hearing will be almost near complete at birth. Language function will be still developing, and the cognitive function development will go on till into the adolescent. In addition, the brain is also in a process of development. The development into the brain developed by increasing its number of neurons and making the neuronal connections, that is synapses, or simple terms, networking. See, the cells in our brain, they will main, because the child development will be happening in the early years in the terms of the number of neurons and number of synapses, that is the networking. So this networking will be taking place very early, and those networks which are used will be preserved, and those networks which will not be used, they will go for something called as a apoptosis, and each neuron will be making more than 700 synapses per second in the early years. So if you start the interventions early, it will help us to make these neurons network properly, so that the child will have a better outcome. Every child should have a developmental assessment periodically, that is every 3 months in the first 2 years of life, every 6 months till the school age, and every year in the school age group, to screen for the red flag signals, to identify the special needs, establish the eligibility for evaluation and rehabilitation services. Now, the take home messages, those who are not heard properly, please remember these points. So you should have a regular developmental monitoring of your kids for early recognition of the developmental delay, for assessment of the complete developmental profile of strength and weakness, define the etiology where possible, seek prompt referral for early intervention and stimulation, provide family support and counseling, empower the parents as a caregivers, encourage achievement for an optimal potential. Thank you. So sorry for that voice problem.
I think we have some question in the chat box. I would like to read that for you, sir. So, Miss Rachna Pathak wants to ask: my child is of age 5 and suffering from ADHD and autism spectrum. Giving milk is good or not? What to give as diet that has nutrition but keeps the energy low? Would you like to address this answer?
Yeah, sure.
Yeah.
So the voice is audible and clear? Hello?
I think yes, sir. I think it is.
It is audible now.
Yeah.
So the child for this kids with the neurodevelopmental disorders, there are various diet therapies you may be see in the internet, but none of them have a proved benefits. Okay, so if you can give the milk and milk product, definitely there is no contraindication for giving the milk or milk products for the kids affected with the autism or ADHD.
Okay, thank you, sir. There's another question I can see. So, Mr. Amrut Mishra wants to ask, for ADHD medical with behavior means question mark, what medical types and any medicines or what? So
yeah, see in the biology of the ADHD is, so if you see the ADHD kids, they will be hyperactive and they will be impulsive. Okay, so if you see the biological process where in the there will be deficit in the neurotransmitters. To make it simple, their brain is not will not be controlling the abnormal movements, because actually even though the kids will be hyperactive, but the brain is not working as forward, and the brain will be that it is a, we call it some inhibitory area of the brain or not functioning normally. That's why the child will be hyperactive. So for in the kids with the ADHD, you will give a medications called stimulants. The stimulants, there are two types, stimulants and non-stimulants. Most commonly we use the stimulant medication. The stimulant medication will stimulate the brain, especially those inhibitory part of the brain. They will be stimulating that part by increasing the neurotransmitter. So that will help to control the child hyperactive symptoms and impulsive symptoms.
Excuse me, sir. Good afternoon.
Yeah.
Good evening. Actually, means ADHD means so something is their mood. Means sometimes my child is 6 years old. He has ASD and ADHD also. ADHD means he is not interested in sitting during the study time or in the class, and school complaints. So so another thing is sometimes he writes well, suppose 2-3 pages, and sometimes he's not writing. Whether he knows the answer, then not writing. Means I think that depends upon mood. So in case of ADHD also, that depends upon mood, or it is any other abnormal or what?
See, the ADHD, if you, it is that there's a no, I don't know what for the mood you are mentioning. So basically, they will have difficulty in controlling by themselves. So they will not able to sit in one place. They will not able to concentrate in for a particular period of time. They will be inattentive. They want always to move from one place to the another place, and majority of the ADHD kids will have their IQ will be normal. Some may be having a deficit in IQ, but majority will be having a normal IQ.
But I feel that you told learning disability. Sometimes I mean, suppose addition, he can do. Means learning disability is also present, I think, in my son.
Yeah, ADHD kids may be having associated learning disability, and that sometimes because of the learning disabled kids, because of their learning problems, it may mimic as a ADHD.
Mimic as?
It can mimic, means it can show as a ADHD symptoms. They need not be having a hyperactive symptoms. So you need to evaluate the child and differentiate whether it is a because of his learning problem is being as a hyperactive, or truly it is an hyperactive symptoms.
Achha. Now in the slide you show mood disorders, anxiety disorders.
Well, that is in autism spectrum disorder.
Autism spectrum disorder. Achha. Is the medical means, is it better to medicate for ADHD? Give medicine?
For ASD, there are, we will give you the medication to control his hyperactive symptoms and his irritable symptoms. As such, there are no, like for ADHD, there are no modifiable drugs for autism.
Achha. Means no medicine for autism, but we can just slow the for hyperactive by medicine.
Associated hyperactive symptoms, or is having irritable symptoms, we can use the medications.
Achha. Okay. Thank you, sir.
Okay, thank you.
okay, so we can go to our next question, which is from Mr. Chiranjeevi, and he's asking about food for ADHD. Food.
Hello, it was not audible.
Hello. Sir, am I audible now? Hello.
Yeah, continue, madam.
Yeah. So we have another question from Mr. Chiranjeevi, and he's asking about food for ADHD.
Food.
Yes, sir. Food.
Yeah, yeah.
Okay. Well, because this, I think, a question I have already answered. So there are various products which are available commercially for various neurodevelopmental disorders, and nobody knows whether they are working or not. For scientifically, none have proven benefit. Even though they say casein-free diet, gluten-free diet may help the symptoms of autism or hyperactivity, but they are not completely evidence-based. So as such, right now there are no dietary therapies which is available for neurodevelopmental disorders, except there are some underlying metabolic condition.
Okay, sir. Thank you. And I would like to go to our next question, which is from Maithili. She wants to ask, what is the correct age for early intervention?
Yeah, I think I've already clarified this. See, there is no age group for the early interventions, and because if you feel if your child is having deviating from his normal developmental domain, so we have to start the interventions. Pending is diagnosis, means is a clinical diagnosis and is etiological diagnosis. Start intervention early. So because the diagnosis to establish his diagnosis and to prove the underlying etiology, it will take time. So don't instead of buying the time, so you have to start the intervention as early as possible according to his symptoms. I don't think there is any early age group for the early intervention program. There is something called early stimulations. We can start stimulation even from the birth. So depending upon the child behavior, we can start either early stimulations or early interventions, but you should not postpone them.
Okay, sir. The next question is from Mr. Kavish, and he wants to ask, my child is 4.5 years. He is not having autism, CP, or ADHD, bit motor delays. How to treat? He is having gross motor and fine motor delays. Please suggest something.
See, they are asking that the child is having a motor skills delay. Okay, so the motor skill delay is always need not to be a cerebral palsy. If other domains like speech and social interactions are
problem. Somebody says ki he is also having oral motor problem and gross motor problem and fine motor skills mein usko thodi problem hai.
Yeah, no. So basically the child is having a motor issues.
Ji.
Yeah. So if the child is having a motor issue and if you feel it is not cerebral palsy, so it is better to consult the pediatricians or pediatric neurologists.
Sir, I have enrolled with Mom's Belief already, पर 1 month में अभी उसको कुछ improvement नहीं आया है इतनी जल्दी. तो क्या आप कुछ suggest कर सकते हैं? Will you suggest something कि जैसे कभी किसी की और की एडवाइस से भी कुछ समझ में आ जाता है. बेसिकली प्रॉब्लम उसको सिर्फ जैसे उसका आईपी बना था तो उसको प्रॉब्लम सिर्फ ग्रॉस मोटर और फाइन मोटर्स में और स्पीच में प्रॉब्लम है. स्पीच में भी ऐसा है कि आर्टिकुलेशन में प्रॉब्लम है. बाकी वो बोलता पूरा है, बट उसने कुछ हिंदी कॉन्सोनेंट्स में से 7-8 अल्फाबेट्स में से ही उसने अपनी पूरी लैंग्वेज बना ली है. तो हर जगह उसी 7-8 अल्फाबेट को यूज करता है. लोग समझते भी हैं, समटाइम्स नहीं समझ में आता है. मतलब सिर्फ आर्टिकुलेशन में, स्पीच में प्रॉब्लम है. और जैसे अपने डेली रूटीन वर्क्स करने में कर लेता है पर उतना प्रॉपर नहीं करता है. एंड व्हाइल राइटिंग ही यूजेस हिज 4 फिंगर्स. उसकी ग्रिपिंग प्रॉपर नहीं है. जैसे कपड़े वगैरह पहनता है तो जैसे अगर अपनी पैंट्स पहन रहा है तो प्रॉपरली अप नहीं कर पाता है. बाकी ही स्मार्ट इनफ फॉर एवरीथिंग. सोशल एक्टिविटीज में भी अच्छा है. तो यहाँ क्या एक सी चीज करें कि मतलब कुछ उसमें चेंज है.
Okay. So the basic issue is what is the exact clinical syndrome he is having. Okay. So I don't have any of the child medical reports. because the way you are telling the child is having a motor delay, in addition is having some articulation problem. Okay, I think the child may be having some other the underlying medical conditions. So for that you need to consult your doctors, and for irrespective of the underlying medical problem, because the way you describe, I think the child is having maybe some brain development, like some syndromic diagnosis. That's what I can say, but depending on your symptoms. But whatever may be the cause, so you have to give a training for his speech, for his articulation and his motor. And please remember, all viewers, the therapies will take a time. Okay. So, and they will slowly help to improve the child over a period. It cannot happen if it is not happening in weeks or months, it may happen over years. Okay, so depending upon his genetic potential, his improvement will depends. So you have to know because of what exact reason is having a delayed development. So based on that, it will help us to prognosticate to what extent your kid is going to improve.
Okay, I hope you have got your answer, ma'am. The next question is from Piyush. Is there any role of L-carnosine suspension in case of ADHD?
I didn't get you.
So the question is written there. Is there any role of L-carnosine suspension in case of ADHD? You can read in the chat box if you can see from Piyush.
Is there any role of L-carnosine suspension in case of ADHD?
Piyush, you can ask your question.
Yeah.
Okay. So
Sir, can you listen me? Hello. Am I audible?
Yes, you are. Please ask your question.
Okay. Is there any role of L-carnosine suspension? Just L-carnosine, medicine.
I got it.
In case of AD, can we provide this suspension to our child? He's suffering from ASD along with ADHD.
Yeah, I got your question. See, there are these are all maybe available since the last 4-5 years in the market for the various neurodevelopmental disorders. Okay, so whether they are going to completely benefit the child or not, still we requires time. It is unlike the stimulant medication where they have proven themselves. This L-carnosine and the DHA and any other the food supplements, we should have a very vigorous randomized clinical studies before recommending them as for the treatment. But I agree to you that many of the practitioners, they are using in their day-to-day practice. Some may have shown improvement, some may not shown improvement. To recommend as a treatment for ADHD and ASD, I think we still we have to get the longitudinal data from the longitudinal studies. Then only we will be able to recommend them as a treatment per se. Till that time, it is like try this, try that, and try only.
Okay, thank you, sir. We have another question from Ivan's mother. She wants to ask, my son has MPPH and GDD. He is taking Valpari from last 2 years. How does that affect growth otherwise? Also, do these medicines cause any sleepiness while he is doing exercise? Yes.
My MPPH and GD. My MPPH is
Tarang, can you unmute Ivan's mother if we can question?
Yeah, sure.
Yeah.
Hello, you can ask your question.
Hello. I think, yeah.
Hello.
Yeah, can I know what is
Yes.
what do you mean by MPPH?
So yes, sir. MPPH. So this is a very rare syndrome. Hello.
Yeah, I'm listening.
Okay. Yes, sir. So this is a very rare syndrome. This is megalencephaly polymicrogyria polydactyly hydrocephalus.
Okay. Okay. So
I mean, sir, he has 6 digits, both on hands and on toes, in toes, sir,
that's
and
okay. That's fine.
also he
I got
has
it. I got your question. So basically, your child is having the syndromic diagnosis, and
yes, sir.
because of for his seizures, your doctors have prescribed Valparin.
Actually, sir, before going to the seizures thing, whenever, sir, actually, I'm also a medico. Sir, whenever I was told that he is having seizures, sir, I was also told that seizure is something which can be controlled, or which can't be controlled, or which can't be, stopped if the child is having it. But in case of Ivan, sir, this is like if he is listening to some new voices, like the voice of pressure cooker or something, he used to show the thing like more reflex or something. Sir, the moment got used to those voices, and also, sir, whenever I find that he's going to get scared of that voice. If I hug him tightly, he never get those seizures. Sir, I'm always confused about this thing. Is this really seizure, and do really we need to give him medications for these?
See, what you are describing is, as soon as if he hears sudden sound, you will have some starter-like response. So
yes,
you will
sir.
have some jerk-like response, isn't it?
Yes, sir. Yes, sir.
So that maybe it is called as a hyperacusis. The hyperacusis maybe is if we having so many causes. Those kids with having the brain developmental problem can have hyperacusis, and it may be a seizures or it may not be a seizures. For that we have to do a video EEG and capture those events and see whether those events are associated with the EEG changes or not. If those events are associated with the EEG, that is epileptic activity, then can take them as seizures. But invariably, if the child is having a brain developmental problem, these kind of symptoms will be having a seizures.
Okay, sir. Also, sir, like you also asked me that what is MPPH, sir. Actually, I purposefully wrote MPPH just to know that why many people don't know about this, sir. If sir,
See,
sir,
these syndromes are very rare. So,
sir, how to go about it? Sir, sir, how to go about it? How to find what can be the prognosis? What can be the precautions I can take as a mother? And
I think it is better to consult with the nearby pediatric neurologist. I think if you have already made a genetic syndromic diagnosis, they will be in a better position to explain the prognosis. So it will be, if I say something to the video or like in this conference, the prognosis and other thing, it is very difficult to counsel. So I think better you can consult neurologist, pediatric neurologist near you or a genetic neurologist.
Oh, okay, sir. Sir, also like my question is, sir, these medicines like Valparin or Pacitin or everything, sir, do these medicines cause sleepiness or do they hinder his, I mean, progress with exercises or something?
See, the Valparin is a antiepileptic and it is a pretty safe drug.
Okay, sir.
It's having a side effects, but usually it will not affect the growth. So it will have other side effects.
Okay, and also, sir, is there something like beyond 5 years, the mental growth doesn't grow with that pace? Or, I mean, should we hurriedly go about it that if he is now 3.2 and we need to reach certain levels till 5 years of age?
I think we're having a lot of doubt, so we can take it separately.
Okay, okay, sir.
So I am sharing one Gmail ID on the chat box. If you have any query regarding, so you can directly mail to us.
And thank you, ma'am, for your question. Yeah.
Apurva, you can go for another one question.
Yeah. Okay. So the next question we have from Pihul Bhati is that how long it takes to get the autistic child on track in terms of overall development? Yes, sir.
Yeah, I think this is a very good question and very difficult to answer also. Okay. So again, the autism, it is a spectrum disease. Okay. Some kids will they improve fast. Some kids will take a time. So it basically more than the improvement. Our aim in training the autism kids should be to make them independent as possible.
Okay. Thank you so much, sir. Dr. Nani, you want to add on something?
Tarang, I think Dr. Naini is on another call. So I think we are done with all the questions. So anybody has any other questions to ask?
I think Kavish want to ask something.
Hello, sir.
Yeah.
As you said कि उसमें इतना मेरे बेटे में इतना जैसे सीपी की प्रॉब्लम नहीं है, ऑटिज्म की प्रॉब्लम नहीं है, तो आप ये सजेस्ट कर सकते हैं क्या कि उसको मेडिकेशन से सही करना चाहिए या फिर थेरेपीज ही सही करेंगी? जैसे अभी ओटीपी चल रहा है उसका मोटर डिलेज के लिए और स्पीच के लिए स्पीच थेरेपी भी चल रही है, तो क्या उसको न्यूरोलॉजिस्ट को भी कंसल्ट करना चाहिए? जैसे मॉम्स बिलीफ में साइकोलॉजिस्ट तो है, स्पीच थेरेपिस्ट भी है, ओटी भी है, ठीक है, बहुत धीरे धीरे इम्प्रूवमेंट आ रहा है, आई एग्री कि आ जाएगा, बट क्या किसी न्यूरोलॉजिस्ट की राय भी ले लेनी चाहिए? आप क्या सजेस्ट करेंगे?
I think I forgot to mention the medication per se have a very minimal role in majority of the neurodevelopmental disorders.
कुछ रिपोर्ट्स भी करानी चाहिए उसकी?
So more than medication, it is the therapies which is more important, especially the condition like your child is. There are only like the ADHD or seizures or associated psychological or psychiatric symptoms. There are no medications to improve the underlying genetic conditions.
Okay, thank you, sir. I think we have exceeded our timeline. So I would like to end this session for today. Thank you so much, sir, for your wonderful and informative session, and thank you to all the parents and professionals for joining with us today. Thank you and have a good day.
Thank you. Thank you.
Thank you, Dr. Yathish.
For organizing this interactive webinar.
Yeah, thank you so much. Thank you for your valuable time. Thanks the parents, those who have been participated in this session. I hope it would benefit some way, definitely, for sure. So for any queries, so we have put a email ID like query@momsbelief, so you can get in touch with us. So we'll try to address if any further queries, for sure.
Thank you, sir. Thank you all the participants for joining. Have a good day.
Have a good day. Bye-bye.